welcome to Connect the World. I'm Lynda Kinkade, filling in for my colleague Becky Anderson. Good to have you with us. Well, we begin with an unwanted global record and a grim warning about the coming months. India's COVID crisis is getting worse by the day. The country reporting more than 360,000 new cases today, the most anywhere in a single day since the start of this pandemic. And nearly 3,300 people died, the most ever in India in one day. India's official death toll now tops 200,000. An influential model here in the US projects nearly 1 million people in India could die of COVID-19 by this coming August. Video from Delhi shows just how bad things have gotten. You can see empty oxygen tanks lining the streets of this neighborhood. With many hospitals running out of oxygen, patients and their families are forced into a desperate search, some willing to pay exorbitant amounts of money to fill a tank. Those who don't survive are filling crematoriums, which are now sadly operating right around the clock. The North Delhi mayor is requesting a steady supply of firewood to keep the crematoriums running. He tells CNN they're cremating more than 600 bodies a day, double the official daily death toll. Well, India's government has been criticised for a slow vaccine rollout. Today, Serum Institute of India, the world's biggest vaccine maker, announced an immediate price reduction for COVID vaccines from about $5.30 a dose to $4. Its CEO says the move will hike the number of vaccinations in India. Senior international correspondent Sam Kiley is on the ground for us in New Delhi. Whichever way you look at it, Sam, it's a pretty dire picture there in India, and it seems that even as horrifying as the numbers are, the real figure may be far worse than official government data.
Yeah, I mean, that is the case, Lynda, right across the world. No nation has ever been able to get any kind of anything approaching an accurate idea of how many people have been infected, and therefore a very inaccurate idea about how many people have died. But here in a country of 1.4 billion people with a widespread poverty and fairly rudimentary systems of administration out in some of the far-flung areas, those figures are obviously going to be even lower. So we do have this report coming from the United States that by August they've been modeling for about 1 million dead in India. The figures now over 200,000, but again, medical experts here analysing what's been going on believe that that could be a very substantial underestimate, as indeed is the numbers of people actually infected. It tends to be people who are either anxious that they've got the disease or actually having the disease that are trying to get tested. We've got reports here in Delhi that a number of test centres have been overwhelmed and effectively had to shut up shop, just as there is rather a catastrophic shortage of oxygen right across the Indian capital and in other states too, and of course a shortage of actual beds for patients to be treated in. So we've seen examples of people getting hold of bootleg oxygen very often and being treated from their cars, pipes going from oxygen cylinders into the back seats of cars where patients have been languishing across the back seats. There's also, of course, inevitably, with the high death toll, a surge in the number of people being cremated here, with some really terrifying medieval apocalyptic scenes in some of the extended crematoriums that are now burning well into the night, long after the ceremonies have been conducted, simply because there are so many people that have to have the last rites here. And there's no sign at all of the numbers of people being infected, nor the numbers of people being infected who are dying easing off. Indeed, all of the indications are that things are going to get a lot worse before they get better, Lynda.
And obviously, people are desperate to get a vaccine for COVID-19 there. And despite the fact that India is the world's largest producer of vaccines, very few people have had the opportunity to get a vaccine. Just a few over 1%, I believe. Why is that the case?
I think essentially there are two issues here. First is that the vaccine producers have been exporting to countries that have been aggressively buying their vaccines. You talked earlier on in your introduction about one of the major producers of the AstraZeneca, the major producer of the AstraZeneca vaccine dropping their price. That is in order to relieve the burden on state governments, because in places like Maharashtra, for example, where they have the capacity or had the capacity to vaccinate some 800,000 people a day, they've actually closed a lot of their vaccination centres because they can only get supplies of some 200,000. That is partly due to logistical hold-ups, partly due to the fact that there's been a prioritisation perhaps of export of vaccines, but that's against a background of a national sense driven by the central government, driven by Prime Minister Narendra Modi, that India had seen the COVID pandemic off, that it had essentially won against the pandemic without the necessity for mass vaccinations on the scale of, in terms of percentages of the population that we've seen in countries like Israel, the UAE, United Kingdom and the United States, but rather that the country had somehow miraculously reached a level of herd immunity. If you combine that with large numbers of mass gatherings for religious festivals, many millions turning out for religious festivals, to political campaign rallies, you create essentially a perfect storm for a disaster, and that is exactly what is unfolding, particularly here in New Delhi, Lynda.
It's sad but true. All right, Sam Kiley for us. Good to have you on the ground in New Delhi. Thank you. Well, India's devastating COVID chaos is now spreading to neighbouring countries, with Nepal facing an alarming surge in cases. The Ministry of Health there is sourcing 20,000 extra oxygen cylinders from abroad as they prepare to deal with the country's limited supply. Doctors say they're worried things will get worse, and with the devastation they're seeing across the border, it's no wonder they're concerned. Take a look. In parts of Nepal, hospitals are struggling to cope with a sudden surge in cases. We brought him to hospital in an ambulance because he was having trouble breathing, says this woman whose husband has COVID-19. But she says no doctor has seen him yet. Everyone is busy. The medical staff is struggling to keep up with new infections. Johns Hopkins University data shows cases are rapidly rising across the country, with the highest number of daily infections since the October peak.
Now the hospital beds are full. This is the beginning of another wave. We are a little surprised as the people are getting infected and falling sick rather quickly and are having to get admitted to hospitals.
Some public health experts warn that thousands of people may have caught more infectious variants first identified in the UK and in neighbouring India. Now some border cities have become hotspots, raising fears that the situation will only worsen.
I call that a mini India. If the same thing replicates in a densely populated city like Kathmandu, then it may give rise to a difficult situation.
Nepal's capital is one of a number of cities across the country imposing lockdowns starting Thursday. Local governments hoping to prevent infections from spreading, as a vaccination campaign could soon be in peril. Nepal depends in part on India's Serum Institute for vaccines, but India is prioritising its own needs as infections there spiral out of control. In Nepal, the decision to reopen Mount Everest to climbers is proving challenging. COVID-19 has reportedly reached base camp. The government, however, denies those reports, and Nepalese officials say they haven't received any official notices of that.